Let's talk about the 5 biggest mistakes that I see in wound care. So I've been doing wound care for the past 8 years, and these are things that I've discovered that are very important that can help your practice. So number 1, Dakins is overused. Number 2, we're using creams on fungal or diaper rashes when we need to dry them out. 3 is using lots of ointments or creams on wounds that are draining. Doesn't make sense to put an ointment or cream on if the wound is a flood. 4 is overprescribing antibiotics and not choosing the right antibiotics. And 5 is not going over the most important things in terms of wound care, meaning you're focusing on the dressing and not focusing on what caused the wound and how to improve the patient's overall being. All right, so let's go into each one. Number 1, why don't I like Dakins in chronic wounds? Is Dakins good for wounds? Yes, you heard the buzzer. It's not good for chronic wounds. It's very good for acute wounds, meaning if there's an infection. The reason is Dakins is basically a diluted bleach, which helps get rid of the bacteria and reduces the microbial load. We've talked about these in previous videos. The problem is when you get to a chronic wound, the wound should no longer be infected. And what Dakins does, it actually impairs wound healing potential in chronic wounds. So it's not uncommon that I see patients going to wound care facilities or other nurses or other healthcare providers, and they're still using Dakins on a chronic wound. The Dakins prevents what a cell called fibroblast from producing healing factors that can heal the wound. So Dakins is a no-no for chronic wounds. Now, it's great for acute wounds when they're infected only for 1 to 2 weeks, but for chronic wounds, it's a no-no. Okay, so another thing that I frequently see is using creams in fungal rashes or diaper rashes. What is a fungal rash or diaper rash? A lot of times when you have accumulation of fluid, sweat, or other bodily fluids, you get a rash. A lot of this times is from fungus. And the reason why this is fungus loves to grow in crevices or little lines or folds, like in the breast fold or in the feet. Remember, us boys and girls got athlete's foot when we were younger. We had to change our socks and we had to use powder. It doesn't make sense to put a cream on. It makes much more sense to use a powder, a fungal powder such as Nystatin or other powders such as Z-Zorb. To one, you want to dry the area where there's a lot of fluid and bodily secretions, and you want to dry the area out. If you can dry this area out, the fungus can't really survive and thrive in a moist environment. So the point is you want to air things out and you want to use powder to dry it out. So you don't want to use creams and ointments in fungal rashes or rashes that are due to fungus, particularly in the buttock area, because a lot of the time that's due to the diaper being on too long and it's trapping moisture, whether it's poop or pee or other things. So we want to dry these out. So I recommend fungal powders such as Z-Zorb or Nystatin. Okay, let's talk about antibiotics. Now, I'm not anti-antibiotics, but also I'm not pro-antibiotics. Why can antibiotics be bad? Number 1, they may not targeting the right bacteria, the right organism that's causing infection. Number 2, they can mess up your bowels, meaning if you're on antibiotics too long, they can get something called Clostridium difficile or C. diff, which means you start getting diarrhea and it's not good. So you don't want to change the good bacteria in your gut because you're on antibiotics. Now, there are times, and many of my patients that I'm seeing that have acute wounds that are infected, they need antibiotics. You need to have a broad spectrum coverage. So you need to have both positive coverage as well as negative coverage and something called anaerobes. So I generally use the following combination: doxycycline with either cefpodoxime or cefdinir. These are type of antibiotics in the cephalosporin grade 3 level that cover the gram negatives, because when you have poop or pee or things like that, they generally have gram negative bacteria. So you don't want to do Keflex. Keflex is what a lot of the primary care physicians or other plastic surgeons or other people in the wound care world use. Keflex doesn't really address MRSA. It also really doesn't address a lot of gram-positive organisms. You need to have gram-negative coverage. That's why I like cefdinir or cefpodoxime. They're given twice a day. The combination I like is the doxycycline, 100 milligrams, given twice a day. It can be put in a capsule, as well as cefdinir, which should be given twice a day, and that's also in a capsule. Sometimes I add flagyl, or that covers anaerobes, meaning that bacteria that don't need oxygen to survive. So it's really important that if you have a wound infection, that you're treating it correctly with the right antibiotic and for the right period of time. Now, it's not uncommon in my patients if I have a pressure ulcer of the sacrum or the backside where we have a wound infection and the bone is infected. So sometimes people are only given 10 days to 2 weeks of antibiotics. That's not long enough. You need to do 4 to 6 weeks, generally 6 weeks. Now, I can do oral antibiotics in the home for 6 weeks. If it's very severe, and we've talked about other patients where they've needed intravenous antibiotics when they get such a bad infection, it gets into the blood system, what we call bacteremia or sepsis. However, in this scenario, I've treated many patients with just oral antibiotics if it's doesn't cause overall systemic disease, meaning it affects the whole body. That's why you have to treat it for a long period of time. A lot of times, acute osteomyelitis, meaning the bone is infected in an acute setting as opposed to chronic, it has to be treated for long enough with the right antibiotics. That's why it's not uncommon that I'll take a piece of tissue, whether it's bone or fat, and actually take a piece and submit that to lab to get the right organism. Swabbing wounds doesn't work. A lot of times I see the primary care physicians as well, nurses swabbing wounds. Number one, they've not been debrided, which means they're contaminated. So you can imagine if I just swabbed my skin, I would grow bacteria. That doesn't mean I'm infected. First of all, I carry a lot of organisms because I'm a healthcare provider. I've been doing this for 3 decades. I have so much bacteria that it doesn't mean it's infected. So that's why you have to do a debridement and a thorough washing, meaning irrigating. Most of the times, we do this in the operating theater or the operating room. However, with my patients that are homebound and bedbound, we can't do this. That's why I do a really clean debridement. I wash it out, usually with anywhere between 500 cc's of normal saline to 1 liter of normal saline, as well as using Vash, which is hypochlorous acid. Then I take a piece of tissue as opposed to just doing a swab, which most likely will be contaminated, meaning it has the wrong bacteria. So that's really important. Another thing that I see routinely is mupirocin or Bactrim, which is a type of ointment that's used. Now, this is an antimicrobial ointment, which is great for superficial things, such as cuts or a very superficial burn. However, it does not minimize the infection or the bacterial load in deep wounds. Most of my patients have very deep wounds. They're like this big and this deep. The ointment is not going to do much of anything. It's not going to penetrate. Mupirocin has been known to have healing effects in small cuts. It does work, like in an acute cut or a simple laceration. However, the wounds that I'm talking about, they're mainly due to pressure ulcers or vascular ulcers. I would not recommend that. So antibiotics are really important. You have to know when to prescribe them and not to prescribe them. Another thing I routinely see in wound care is putting ointments or creams on wounds that are draining. So let's give you a picture of this. If your skin is really wet, does it make sense to put ointment or moisturizer on it? Now, there are certain times that you have to do this. Like penguins will have oily skin because they want to keep their feathers dry. We're not penguins. We don't need to have feathers. But you don't generally want to put ointment on wet skin. It just kind of washes right off. If you're sweating and you put sunscreen on, what happens? It flushes out. That's why you have to change your sunscreen every 2 hours. So a lot of times I see wounds that are heavily draining, meaning they're secreting a lot of fluid and it's coming out. So if you're putting an ointment or such as Silvadene or bacitracin or Bactroban on this, it's going to flush right because all that drainage is going to wash it out. Those ointments are not going to reduce the bacteria that's in the wound. You have to dry these wounds out. That's why I always tell the nurses and the families, let's dry it out. So I usually use alginates, which absorb hydroferroblue. Sometimes I'll use actually a charcoal mixture with an antibiotic powder such as vancomycin or cefepime. That's the first thing. I want to really minimize the drainage because we can reduce the bacteria. So putting on ointments or creams on a heavily drained wound, whether it's on the leg, the butt, or the hip, doesn't make any sense. However, dressings that absorb a lot, such as alginates and hydroferroblue or Drawtech, those hydroconductive dressings, meaning they absorb a lot. They take all the fluid out because we want to dry the wound out. Those are great. All right, so that's really, really important. Okay, so we've gone over a lot of different things. We're going to go over a few more. We have to focus on the most important thing is what caused the wound and how do we minimize it? Okay, I mean minimizing it deteriorating. So a lot of times people just focus on the dressings. We've gone over different dressings in great detail and in great specificity. The dressings are important, but they're sometimes only 5% of the picture. What's in the other 95%? Well, we've gone over this in every single video, the 4 Ps. Pressure relief, plenty of love by the family, protein and nutrition, as well as praying. Okay, those are very important. I know people may be atheists or don't believe in anything. Your prayers can be to anything you believe in. It's a higher power. Whether it's Alexander the Great, Genghis Khan, the Pope, whatever religion you may observe, whether it's Islam, Christianity, Judaism, it's really important to have a positive outlook because this will give you a better chance of healing. You have to have some sort of faith, okay? The 4 Ps are really important, and I've had many patients who've not responded to different wound care, even though using sophisticated wound care supplies because we haven't addressed the underlying issues. I have one patient in Brooklyn who was being turned aggressively during the daytime every 2 to 3 hours. We were doing different wound care regimens. We did Luxtra, hydroferroblue. We switched over to Prism, which is a collagen product, and there was no improvement. The wound had totally stagnated and plateaued. And we're trying to figure out what was going on. I know he ate very well because I saw what he was eating. He had a very high protein diet. He used to be a lifter. The problem we ended up finding after asking the right questions is no one was turning the patient at nighttime. That means he was laying on his butt or his sacrum for 12 hours when he was sleeping. Well, that's a big problem. So once we started getting him to turn more and for the wife and the caregivers to turn him at nighttime, Even though he was being interrupted, the wound started to improve. Another issue I had with the patient was a patient in Manhattan. We were very aggressive. We got the wound much better. It was a huge sacral ulcer that was infected. We got the infection under control after several months. We did the wound care regimen. We were able to start topical oxygen therapy. However, the wound had also plateaued. We did everything that we know. And I knew the patient was being turned aggressive. We found out after checking her labs, she wasn't getting enough protein. Her albumin level and her prealbumin level, which measure protein and nutrition, was very low. So after I probed further, she wasn't following my recommendation about a high protein diet. She was having heavy carbohydrates such as pastas, lots of fruit and lots of vegetables, but no protein. So I was able to get the husband to cook salmon and other fish that she ended up liking, but he had to make them very, very spicy, as well as doing protein shakes. She ended up liking the chocolate Garden of Life protein powder, which she put in smoothies 2 or 3 times a day. And lo and behold, after adding different supplements such as L-arginine, vitamin C, and zinc, and selenium, the wound started to heal and now is actually healed. So it shows you that you really have to focus on the important things: turning, protein, having family involved, showing a lot of love, as well as having some sort of faith and optimism. All of these are really important. The dressings such as aqueous and hydrophoric blue won't work at all or work very well or at maximum efficiency if you're not getting to the root cause. Just like a vascular ulcer, meaning a wound on the leg that doesn't have adequate blood flow. A lot of times I see nurses and other healthcare providers, even people do wound care, not addressing underlying issue, which is poor blood flow. What's the only way to improve poor blood flow is to improve the blood flow. Sometimes a vascular surgeon can put a stent in, meaning to improve the blood flow, or he has to bypass where there's a blockage, meaning he has to take a graft and go from where there's good blood flow down to an area to get better blood flow to the foot. Another time, people have venous disease, meaning the venous return to the heart is impaired, meaning you get a block-up of toxins in the leg. And the only way to improve that is not the dressings and the cream, is to squeeze that leg. So you have to use compression, meaning you have to wrap the leg to squeeze all that blood flow back so all those negative toxins and bad metabolites and bad products don't stay down there. The creams and dressings won't work unless you have some sort of compression. So that's why going over the underlying causes as well as fixing those before you actually focus on the actual wound care supply, whether it's Aquacell, Adaptic, Prisma, is really, really important. So we've gone over a lot of things that I don't like in wound care, kind of the 5 no-nos, which I like to hit my buzzer on. One is using Dakins in chronic wounds. Dakins is great for acute wounds that are infected. It really impairs wound healing in chronic wounds. 2, in fungal rashes, which are really not chronic, but sometimes they are, that are in the diaper area or in a fold where there's a lot of moisture. We don't want to use creams. We want to dry them out with a fungal powder, even sometimes cornstarch or Z-Zorb. These are over the counter. You want to minimize your moisture, just like when you had athlete's foot as a kid. 3 is antibiotics. They have to be used correctly. If there's an infection, you don't want to just give antibiotics to every wound because you can get resistance, number 1. 2, you can get something called Clostridium difficile, which is a bad bacteria in the gut that can lead to diarrhea and a major infection. 4 is using ointments or creams in wounds that are heavily draining, meaning they have a heavy exudate, meaning they're releasing a lot of fluid. If you're having a flood of fluid from a wound and you're putting ointment and cream on, what's going to happen? It's just going to wash out. Just like putting sunscreen on when you get out of the pool, it's going to be washed out in the pool. That's why you have to keep on applying your sunscreen on a regular basis. So anything that's heavily draining, you want to absorb it with an alginate or hydrophoric blue, which are my preferred dressings, not use creams and ointments. And number 5 is not addressing the underlying causes, not going over the 4 Ps, which is prayers. It doesn't matter who you believe in. Plenty of love and attention from the family and creating a warm, peaceful, and loving environment. 3 is making sure there's no pressure relief. Now, it's a vascular ulcer. You want to improve the blood flow. So it doesn't really apply to the pressure doesn't apply to wounds that have poor blood flow, but it does apply to pressure ulcers from sitting in a bed or in a chair too long, causing a bed sore. And 4 is making sure you have adequate protein and nutrition. These are all very important. I hope this was very helpful. We'll do another episode going over the things that I'd like to use as opposed to focusing on negative. So I'll have more of the green button, meaning the positive ones. I hope this will help your loved one as well as your understanding of how to manage chronic wounds. I'm here to help you all the time. Healing starts at home. You're already on your way. Tomorrow will be a better day. If you need help with your loved one, please reach out. I'm in the New York City, New Jersey area. Make sure you subscribe to the channel and please share with everyone. I look forward to our next episode.